I often hear from my patients that they only get just a handful of minutes with their doctor and aren't exactly sure what to ask in those minutes. And this video is just a list of 10 essential questions every stroke survivor should be asking their doctor to get a better understanding of their stroke, which will help them in their recovery. Hi, my name is Evan. I'm an occupational therapist and certified neurospecialist, and I specialize in stroke rehabilitation. The first question that you should be asking your doctor is, how severe was my stroke and what parts of my brain were affected? Knowing where your stroke was in the brain and how severe can give you an idea of what kinds of deficits you may experience and how long your recovery may be. The second question you should be asking is, what deficits do I have now because of my stroke? Some examples would be hemiplegia, or weakness on one side of the body, aphasia, or difficulty speaking. There's a long list of deficits that could occur as a result of your stroke, and a lot of these deficits may look similar. So it's important to get with your doctor to get a clear-cut list of the deficits you have. That way you know what you can be looking for in your interventions moving forward in your recovery. The third question you should ask your doctor is, what medications am I on? What are their side effects? And what is the purpose of this medication? It's important to understand what medications you are taking and what they are supposed to be helping with. You should also be able to identify any possible side effects with those medications. So it's important to know what side effects to look for, and that way whenever you are taking them, you can jot down what you're experiencing and bring that to your doctor to make a decision on if that medication is right for you. The fourth question you should ask is, are there any lifestyle changes I should be doing to prevent another stroke? Nothing will halt your recovery faster than another stroke. And it's a sad reality that 1 in 4 stroke survivors are going to have another stroke in their lifetime. Since the vast majority of strokes are seen as caused by lifestyle factors, it's important to get with your doctor to see if there's any changes that you can make that are going to decrease your risk of having another stroke. This could be simple as quitting smoking, reducing your alcohol intake, exercising more, working on getting better sleep, improving your nutrition to eat more whole foods versus processed foods. These all make a huge difference in your body's ability to prevent stroke. The fifth question you should ask your doctor is it safe for me to drive? And if not, when will it be safe for me to drive? Even minor strokes can cause cognitive impairments and make you unsafe to drive. And it's important to know that when you're driving, it's not just your life that you're putting at risk, it's the lives of others as well. So please listen to your doctor if they tell you you're unsafe to drive, and question them on when it would be safe for you to drive, because that may look different for everybody. If they can't give you an answer, you can always ask them for a referral to a certified driving rehabilitative specialist in your area, and they can help rehabilitate driving for you and get you back on the road safely. The sixth question is, are there any local support groups or online resources you recommend for stroke survivors? Having social support after stroke is very important, and not everybody has family or friends who can help them in the recovery. So your doctor may be able to connect you to some valuable social support groups in your area or social services to help you in your stroke recovery. The seventh question is, can occupational therapy, speech therapy, or physical therapy help me in my recovery? And if so, can you write me an order for therapy? Whenever possible, ask your doctor for some more therapy. And nowadays, insurance is only giving a handful of visits for anybody, but especially stroke survivors, is making a big impact on their recovery. So you're going to have periods of therapy and periods without therapy. So whenever you do go to the doctor, it's the best time to ask for more therapy, and most likely they'll give it to you as long as insurance is going to authorize it. The eighth question is, do I have any limitations in therapy? Knowing your limitations in therapy is very important because it'll tell you if you should not be doing specific movements or exercises that could be further damaging your injury. For instance, if you have a shoulder subluxation and you're doing overhead range of motion or your passive range of motion through a caregiver or family member, and hopefully not a therapist, But if they're providing this kind of movement to your shoulder and they're not trained how to do it properly, that can cause damage to the axillary nerve, which is a nerve that runs kind of in the armpit of the shoulder. And it also can cause tears to your rotator cuff. And the last thing you need right now is a rotator cuff tear, in addition to everything you're going through with your stroke. The ninth question is, do you recommend any specialized treatments for my spasticity? Spasticity can halt recoveries and plateau them. While initially, if you have no movement in your arm, spasticity is a good thing, you'll quickly learn that spasticity can be a very frustrating condition to manage. Some stroke survivors have severe spasticity, and that requires additional treatments like oral baclofen, Botox injections, or in some cases, baclofen pumps. And the last question is, do I need any hand or foot orthotics as a result of my stroke? Orthotics of the hand help position the hand and fingers in a functional and safe position to help prevent contractures. Ankle foot orthotics, or AFOs, are mostly used for people who have drop foot as a result of their stroke, and that provides support at the ankle so that when they're walking, their foot doesn't drag and cause them to trip. But these are all hopefully temporary solutions to aid in your recovery while you continue to work on improving your motor coordination and control in those muscles that are affected. Well, these are the 10 questions I recommend every stroke survivor ask their doctor about their stroke to give them an idea of what their deficits are and what treatments and resources are available to them to help them make a fuller recovery. Also, don't forget to look in the description for the PDF download of these questions if you would like to download and print this document out and take it with you to your doctor's appointment. And that way you don't have to worry about remembering any of these questions, and you can just jot some answers down and make it a little bit simpler for you. If you found this video helpful, the best free thing you can do to help out my channel is to give me a like and a comment down below telling me a little bit about your stroke and your recovery, and tell me what you're looking for in a online stroke recovery channel. Also be sure to subscribe for more information on stroke recovery and guided exercise videos that you can do to continue your recovery at home. Thank you guys so much for watching, and have a wonderful day.